Thank you, Ian. Tēnā koutou katoa, ko Rachel Mackay hau. My name's Rachel Mackay, and I've got the privilege of having 20 bosses. Kevin's one of them. Because on behalf of all of the DHBs, I've got a fantastic team who help manage and navigate the delivery of the current pharmacy contract, and also help behind the scenes in terms of where we're moving forwards. As Ian's touched on, my job today is to group the key findings that we've got from the National Forum and also the 1920 Forum around the country into key themes and test those with you. We might not have got them quite right, and this is where the thinking stuff comes into play, as we really want to get a feel for have we grouped what we've heard in the right areas. And that's really important because those themes will provide the framework as we start developing the services in more detail moving forwards. Just before I start on what the themes are, there's a word proverb that really resonates for me and hopefully does for you too, which is he tangata, he tangata, he tangata. It won't be new to very many of you, but it is the people, it is the people, it is the people. And I think all the previous speakers have touched on this. And this process is about the people. Whether we call people consumers or patients or mums or dads or kids or grandmas or granddads or brothers or sisters. It's all about people. And at the heart of change is the change of people. It's the people's ABCs, which is attitude, behaviour and culture. And then we change processes and work procedures and change the tools that they use. And the right people, with the right approach, will actually fix the processes and keep them fixed. And processes don't run themselves. It's actually about enabling people to do what they can do to the very best of their ability. And when we're on the road listening to people in the local forums, there's amazing work going on out there. But most of it's driven by local relationships, passion, enthusiasm, and an absolute pride in what they do. And it's almost sometimes success almost against what the system has provided them as terms of a framework. So we want to turn that around a wee bit and make sure the framework really enables that to happen. We know we need to do things differently to make sure we all have access to the right pharmacist services at the right time and in the right place, and the knowledge that there's always going to be funding constraints and competing priorities. Getting this right is our responsibility, and working together will mean we can achieve more. And it's never been more important to know what services are needed and by whom, so that together we can make sure the right services reach the right people when they need it. The conversations over the past few months have helped us understand what matters to consumers and what's needed, and they've been informed by the Pharmacy Action Plan, the health strategy, the evaluation of the current contract, and most recently, the voices we've heard and the stuff we've heard from people's hearts, and that's been really, really valuable. So in the following slides, I'm going to try and group some of that into some key themes and test it with you guys. The first one, this is in no particular order, is access to pharmacist services. It was widely discussed around the forums, and it's a high priority for consumers. We know that people want to be able to access services that are easy to get to, and what that may mean is pharmacy leaving the four walls. I heard a lot of conversations around pharmacist services in general practice, pharmacist services in the home, pharmacist services in an integrated family health centre. Consumers also value relationships and understand that an ongoing relationship with a recognised health professional builds trust and confidence for consumers and for the wider team. Consumers do perceive cost as a barrier to receiving services, and one of the quotes we had was, "Cost is and always will be a barrier. If you have no money, you have no medicine." One of the bits of feedback that stuck with me in the Northland meeting was some feedback from one of the Māori health providers from Kaitaia, saying it's not a case of if the car's registered and warranted, that kind of just goes without saying. It's actually about, have I got $5 to put petrol in the tank to get to town? And there's also been discussion on triaging consumers at the point of contact. Now, whether that's in a pharmacy in terms of a community pharmacy building or outside those four walls in a person's home. Consumers want to know what services are available. I think it would be fair to say that all of the forums that I was at, there was a great deal of surprise of the sorts of services that pharmacists could offer. And consumers need to know how to find out that information and find it out easily. Services need to be user-friendly and cater for individual needs, flexibility of opening hours, options, alternatives, consumer-friendly pharmacies, hearing loops, easy access for wheelchairs. Safe places to have private conversations. It's all those sorts of things that people want. People have to feel that they're going into a place that they're comfortable before they're actually going to start talking around personal things. And the other thing is consumers have also raised they want to know who the pharmacist is, because sometimes they're not sure if they're talking to the long-com lady, a technician or a pharmacist. Another key theme we've picked up on is consumer empowerment through information. Health literacy is vital to empowering the consumer, and many of the conversations have been around health literacy and how this is vital to enabling informed conversations. Consumers need to be empowered through information. They also don't want to tell their stories several times, and that's been touched on already today. And they're looking for one source of truth with shared information and access to their own medical records. There's lots of conversations around Dr. Google and how very many versions there are of Dr. Google and what Dr. Google can say on different days. Consumers need access to tools and knowledge to manage what matters to them about their health. And what matters to me might be different than what matters to someone else. Consumers have said, for example, that when a person is newly diagnosed, they often need greater assistance and support, and this can be provided by pharmacists when a person first picks up their medication. And one of the quotes we had from the regional forums from a consumer was, "The truth is, I don't really know anything about medicines, and I don't know about the medicines I've been prescribed, and I don't really understand what they do." The third theme we've picked up on was the safe supply of medicines. Historically, the contract, the pharmacy services contract, has focused on the supply of medicines, and the patient-centric services have, until the last few years, kind of been a byproduct of the supply contract. What we're trying to do is kind of turn that on its head a bit. Many of the conversations, the safe supply of medicines was raised whether via dispensing or picking up of a prescription as a result of a standing order or following triage by a pharmacist. Whatever changes are made going forwards, we will always need to be able to get the right medicine to the consumer, so this theme will always be on the table in one form or another. For example, moving forwards, is there a role for a dispensing technician? Is that would free up a pharmacist's time to get out of the dispensary and start spending time with consumers? And would link in with professional standards which require a certain level of pharmacist input. So there's lots of opportunities to try and address, oops, what have I done there? Cool, yeah. Thank you.
No worries.
So there's lots of opportunities to try and address some of those issues. There needs to be both effective and efficient delivery of medicines to the consumer. We've also touched on this already today, and we've grouped it as one of our key themes, which is the integration of care provision. Many of the conversations that myself and my team have been party to have talked about the continuity of care and integration of care provision. Consumers want seamless care from home to the hospital, back again to home, into respite care, into aged residential care. And what we're talking about here, that in general terms, is when a person presents, whether they're in Auckland or in Greymouth or in Invercargill, that they should be able to accept the same level of care and again not have to tell their story lots of times. We know that we all need to be on the same page, as integration will not work if you're not on the same page. You've got to have the same focus, and it's always got to be the patient. And that was some feedback we received in the forums. We know we need to work better together and that we need to use the pharmacist's full skill set. The multidisciplinary team needs to understand what pharmacists can do so they can refer to the patient, so they can refer to the pharmacist. One of the lovely bits of feedback I recall, I think, from Kevin, your Hawke's Bay meeting, was when your GP, one of the GPs who was speaking, stood up and said, "I'm scared of the pharmacist. They know more about medicine than I do." And I thought that was actually a really lovely little vignette, because what it says is pharmacists have spent 5+ years at university learning to be medicines management experts. We need to use that better.
He was also married to a pharmacist.
Maybe that's why he was scared. Pharmacists can provide services such as adherence management support, including medicine therapy assessments, MTAs, And they should be part of the primary care team for case review and team approach for complex consumer needs. At the moment, competition's getting in the way of collaboration, and what we need to do is head towards co-designing services for complex patients. Theme number 5, improve support for high needs patients. There was a lot of really good, vigorous conversation around this in the forums. The evaluation of the current contract highlighted that while there was some success with the long-term condition service, it maybe didn't go quite as far as what we wanted. It's not working in its current state and it needs to change. The evaluation highlighted that LTC service selected the right patients but didn't improve hospitalisation rates. So what we can do is we can use that knowledge and that information to actually try and design the system better as we move forwards. Consumers who are at high risk may need a care coordinator or health navigator, and that came up at quite a few of the forums. And this could be a pharmacist or it could be another healthcare provider who's better placed to support that person, such as a nurse. We know from discussions that it's important to recognise the high points of high need, and these include diagnosis, so that's when someone is newly diagnosed, they need greater assistance and support may be needed. The transition points, when people are transitioning maybe in and out of hospital, when they've been discharged, extra support's needed at that point as well. And also key life events. Change will always add new challenges, and health needs may suffer through a life-changing event such as the death of a carer or a loved one. And key services should be available to all, not just in pockets, both in terms of location and health status. We're into the home straight. This was the last theme we've picked up on, which is utilisation of pharmacists as a first point of contact within primary care. Pharmacists have the skills to act as health navigators, which we've touched on, for consumers particularly being providers of health literacy education or translators into plain English, or being able to triage, then treat and refer to different points of contact. Community pharmacy is a very accessible place for people to go to get services and be triaged. The pharmacy is viewed as a community hub where many people visit and pass through. The pharmacy could be used as a health information hub, utilising the site of the pharmacy and the pharmacist's knowledge. Population screening could take place within the hub, and this came up at quite a few of the forums as well. There's an opportunity for pharmacists to be the community hub, enhancing referral capacity and directing people to other specialist services, providing, in essence, a one-stop shop for the consumer. Right place, right time, right service. The focus should be on the needs of the consumer. Some of the feedback we had was that consumers often feel quite pressured in terms of, are the staff in the pharmacy going to try and sell me something? And the consumer shouldn't feel obliged to buy anything. They need a comfortable private space to discuss issues, and they need the adequate time to make sure that they can revisit any questions and make sure everyone's got a really clear understanding. And I'll just touch on this briefly. Carolyn has covered this already, and enablers are really important. And these are the things that are needed to be able to deliver the services to improve health to our communities. I just want to acknowledge that we've heard these things need attention to varying degrees, but we wouldn't want them or their availability to detract from what we're trying to achieve over the next 2 days. So what we're quite happy to do is kind of have a parking lot, recognising that these things could be some of the issues, but we don't want to let them stop the conversation happening. Thank you. I'll hand back to Ian.